Hello, everyone. Welcome to today's episode of the Counseling Corner. I'm your host, and today we're talking about something really important, what a clinical counselor actually does and how we help people heal. Besides, I'll clear up some common myths about counseling. So if you've ever wondered, do I need therapy? Or what happens in a counseling session? This episode is for you. We often hear the term clinical counselor, but what does it really mean? What do they do? And what's the difference between a counselor and, say, just a friend giving advice? Today, we're diving deep into the world of clinical counseling to understand the vital role these professionals play in our mental well-being. Let's start with the basics. A clinical counselor is a trained and licensed mental health professional. They're like architects of the mind, helping people navigate the complex landscapes of their emotions, thoughts, and behaviors. Think of it this way. If your car breaks down, you don't just ask your neighbor for a quick fix. You take it to a qualified mechanic. Similarly, when your mental or emotional well-being needs attention, a clinical counselor is the expert you turn to. Now, what do they do? Their responsibilities are broad, but they all center around one core principle: helping people improve their mental and emotional health. This can involve anything from helping someone cope with anxiety or depression, to navigating relationship issues, to processing past trauma, to simply providing a safe space to explore their feelings. They use evidence-based techniques like cognitive behavioral therapy, or CBT, to help people understand and change negative thought patterns. They might work with individuals, couples, families, or even groups. One common misconception about clinical counselors is that they're just advice givers. "Oh, I'll just go talk to a counselor and get some advice," yes, you might hear someone say. But that's not quite accurate. A good counselor won't simply tell you what to do. They're not there to give you a prescription for your life. Instead, they act as a guide, helping you explore your own thoughts and feelings, identify your strengths, and develop your own solutions. They empower you to become your own expert. Imagine this. You're feeling overwhelmed by stress at work. A friend might say, "Just quit your job." That's advice. A clinical counselor, on the other hand, would help you explore the source of your stress. Are there specific triggers? Are there coping mechanisms you could develop? Are there communication skills you could improve? They'd help you develop a personalized plan to manage your stress, rather than just offering a quick and potentially unhelpful fix. Finally, let's talk about the stigma surrounding mental health care. For too long, seeking help for mental or emotional issues has been seen as a sign of weakness. This couldn't be further from the truth. Reaching out to a clinical counselor is a sign of strength, self-awareness, and a commitment to your own well-being. It's like going to the doctor for a physical ailment. It's taking care of your health, plain and simple. We need to break down this stigma and recognize that mental health is just as important as physical health. So, the next time you hear the term clinical counselor, remember that they are trained professionals dedicated to supporting and empowering individuals on their journey to mental and emotional wellness. They're not advice givers, they're facilitators of change, and seeking their help is a sign of strength, not weakness. You deserve to feel your best, and with the right support, you can. Thank you.